All right, everyone. I have Lauren Hart Clancy here with me today. She is a mother of two. She has a master's in public health, and she's an advocate for maternal and child health as well as fertility and family building. And she is here today to talk about her unique fertility story. And we're going to talk about advocacy too. So I'm really excited to have Lauren share her story with everybody.
Hi, Becca. Thank you so
Hi,
much for having
Lauren.
me.
You are so welcome. All right, so we're just gonna jump right into it. My first question for you, and this is something I like to ask everybody just to get a little background on you because everybody is different in this way. Take me back to when you were like a little girl. Did you always want to be a mom, or is that something that you were unsure about and later on in life you had this desire to become a mom? What did that look like for you?
It's such a good question. I think that's so interesting as like a sociological experiment, right?
Yeah, definitely.
I did always want to be a mom from way back, and I just think, and I wonder now, like how much of that is cultural, right? Like how much of that is kind of put in the heads of
Definitely.
young girls. But yeah, I did always have that desire, and then I think, becoming a professional and being focused on my career, in my 20s after college and then getting my master's degree, I had certainly had times where I questioned it, whether this was like what I wanted to do and when I wanted to do
Yeah.
it, becoming more aware of the challenges for women professionally in this country, and
Right.
personally, like the journey to motherhood is difficult, but there's just not enough support for moms, and finding the right partner
Right.
at the right time, um, was something that I was concerned about, even though I ended up meeting my now husband when I was, almost 25 years old. Like there was plenty of time, but I just didn't know that at the time. And I just wonder about, you know, the messages that we receive in our lives. But yeah, I did, and I think that desire I had to kind of re-tap into that once we knew we wanted children. I think meeting my husband solidified, yes, I want to be a parent. I want to be a parent with him. And so, um, how do we make that
Yeah,
happen?
exactly. And I think that's a good point. I think that will be interesting to talk to the generation below us in a few years, right? And see what the differences are because I think that's pretty common for maybe
Right.
like millennials to
Yes.
have that idea of like women should be mothers and things like that, where times are kind of changing now and women tend to be more career focused. So it'll
Right.
be interesting to see how that shifts if it does shift at all. But I've
Right.
said this on a different podcast, but I was always that girl that was like I want to have a bunch
Mhm.
of kids, and I was little just like dreaming about that. But I also have some friends that
Yeah.
aren't like that, and they weren't sure until they are older. So it's just
Right.
interesting to hear everyone's different
Yeah.
perspective on that. So it sounds like you met your husband and you guys did decide that wanted to have children together. And that's another thing too, that like when you don't know who your partner is going to be and then you
Right.
decide what works for you and your partnership. So
Yeah.
you guys did decide you wanted to have children together. So tell me when you first decided you wanted to start trying for kids, what was your idea of how that would happen? Was it something that you thought would happen right away, or do you have friends or family members that went through infertility and you had a little bit of a hesitation that it might not happen right away for you?
I mean, I certainly, I don't know. I think maybe we're all naive to this. I don't know, but I certainly thought it would be simple. I thought I knew enough
Mm-hmm.
about
Right.
reproduction and my own body and how this works that it would just be a matter of timing, and that it would
Right.
be hard. So, and I did, I do have people in my life that had gone through fertility treatment before we ended up needing that. So I mean, I was aware, um, but I think it's one of those things that you just never think it's going to happen to you, despite the
Right.
statistics. And I think certainly since then, I mean, this was the end of 2017 that we stopped using contraception. And I think the conversations and just the discourse in the world is become, more so open about talking about this stuff, which, increases every year. It seems like we're more willing to talk
Right.
about this stuff, which I don't know that it was as commonly discussed, 7 years ago, 7.5, but
Right.
yeah, I was aware that, it was a possibility, but I didn't think it would be hard. And that, yeah.
Yeah. And the conversation around this, like you said, is becoming more common, which is wonderful,
Yeah,
because then people can understand that getting testing and things like that can be helpful, so you don't have to your journey doesn't have to be so long if you're able to get ahead of it, even if it might still be long, figuring out what you need to do
right.
to build your family. So,
Yeah.
okay, yeah. So you didn't think that it would be a long journey for you from the very start. So, tell me a little bit about how that first like year went for you before you started seeking
Mhm.
fertility treatment.
Yeah, it ended up being, really, really difficult, even in those months where we weren't in treatment. Like those were the months that I remember feeling like the most sad. I think,
Mm-hmm.
they're just as sad as when we had failures in treatment, because I didn't know what was going on or why. And I didn't feel like I could
Right.
talk about it because it was so soon or so early. But I remember, when we first stopped contraception, I remember us being worried that it was going to happen too quickly. And like,
Okay.
I mean, we were about
Yeah.
to move into our first house like a month later, and we just
Mm-hmm.
wanted to be settled. And I remember just thinking like, maybe we should, be more careful than we planned. It was just, looking back, it seems
Right.
so silly and sad, but yeah, I think
Yeah.
it really only took like a month of focused timing and that not to work out for me to feel like a failure and feel like it was my
Definitely.
fault and start to
Mm-hmm.
become, really consumed with testing ovulation and tracking my cycle. And it, maybe
Mm-hmm.
this I think this is common for a lot of people, but if you're like a type A person who's always been, very successful and driven, and you're a rule follower and you do all the right things and you've seen results from that, when you're doing all the right things, you think, and you're not, getting the answers that you want or the results you want, it's really it's really hard. It's kind of like your
Really
sense of
hard.
self becomes lost or blurred. So it didn't
Definitely.
take long.
Yeah, I think a lot of like type A people can connect with that, or even people who just, really want to have kids, even if they're not a type A person, who really
Right.
wants somebody who really wants to become a mom or a dad, that can be very consuming for them. But here's a question for you. I think this is really interesting too to dig into, because I feel like women are not educated enough on how their bodies work, right? Like we're kind of taught in like sixth grade that if you have sex, you'll get pregnant, and you're not taught like there's a very small window in which you can get pregnant. And going into that, did you have a good understanding of like when you can get pregnant, or what your cycles looked like and when you should try, or what was that journey like for you?
Yeah, I mean, even for me, I actually had in college taught sex education to high school students. So, just in my
Okay.
public health background, I think I knew more than a lot of people about reproduction. Or I like to think that I did. I felt more prepared and that I understood my cycle. I had a regular cycle, but there was more to learn, of course. And as the months went by and we weren't succeeding, I did end up, of course, with my public health brain diving into research and data and looking into learning more. And I did think initially that the fertile window about, like 5 to 7 days, I thought that meant you could get pregnant 1 week out of the 4 weeks of your cycle if you have a 28-day cycle. When in reality, I
Right.
learned it's more like 24 hours, maybe 48. Like that day before ovulation is, your highest chances of conceiving, and then the day of ovulation. but I didn't
Right.
know it was that specific or that narrow of a window initially. So
Mhm.
I think that's
Okay. Okay.
important for people to know.
Definitely. Yeah. Yeah. Because not a lot of women know that. And we have that idea in our head from our experience with sex education that it can just happen anytime, which is
Right.
definitely not the case. So that first year, or like that first time when you were trying
Mhm.
before you figured out there might be an issue, was it sounded like just as hard for you as going through fertility treatments, because it almost sounds like there is like this unknown, right? And
Right.
so that can be really hard to not know, like there
Yeah,
is a problem and what is the problem and how do we fix it? It's just kind of like this,
right.
what is going on, and that can be really difficult too. So that's
Yeah,
interesting.
I mean, certainly nothing compares to how difficult going through fertility treatment is. I don't want to downplay that, but yeah, I think it
Right.
is important to recognize that even trying unassisted can be devastating. And I do remember those months as just being so confusing and feeling so uncertain, and you just become obsessive with, did the timing, down to the
Right.
minute, like what you do before and after, what you're eating, what you're drinking, should I have not had 2 glasses of wine last night instead of one? It just becomes
Uh,
really all consuming. And then you try to, talk yourself out of it and say, oh, it's totally normal, which it is for it to take the average couple 6 months to a year. Like some people
mhm.
are successful much more quickly or not as quickly. But again, I was looking at the research and the data and saying, okay, I'm devastated at 6 months that this hasn't happened yet, but should I be? And of
Right.
course you always should feel how you feel, but that was kind of the battle in my head of like my logical brain and my kind of, broken heart. So,
Yeah, and it's hard to, like, those feelings, it's hard to understand, because if you're not talking to people about it, or you're not talking to friends and family about it, maybe you don't know what other people have gone through, and it can
right.
be hard to like justify those feelings, and you're like, I'm sad about this, but should I be sad about this? Is it
Definitely.
really something that I need to be concerned about, and all of that. So it's very,
Right.
yeah, it's very hard mentally
Yeah.
to go through that. So tell me about, how long did you try before you started to seek help?
Almost exactly a year. Like I said, my IUD was removed in November of 2017, and we first had my husband tested in, I think, early November, end of October 2018. So it was like nearly a year. He had a physical in October, and just shared with his primary care, we've been trying for almost a year. This isn't happening. What do you think? And they did like a full, workup on him and recommended a semen analysis. And we got those results in early November, and they were kind of staggeringly bad, shockingly bad. Kind of all three markers, the count, motility, morphology, were all really low or poor. And that was shocking, for so many reasons. You just don't expect to get news like that. And in some ways,
Mhm.
it can be a relief to get an answer, especially if you've been trying for a while, because you are making yourself crazy trying to figure it out. And by that point, I'd already been putting myself through the ringer, right? Of trying to optimize my
Right.
own health. I'd started going to acupuncture, doing all these things. So I felt, I actually feel guilty about feeling relieved. I was like, oh, thank God we have something to work on. But he was so devastated, understandably.
Yeah.
And those kind of numbers, it wasn't like, okay, change your diet and lifestyle and try again. It was like, oh, you need to be referred to
Right.
a fertility specialist. So it was just a couple of weeks later, right after Thanksgiving, that we first met with our first fertility clinic and doctor and kind of reviewed those results and and heard right out the gate, you're going to need IVF to conceive. And I wasn't
Mhm.
even expecting that. I don't know what I thought we were going to hear, but I knew so many people that had gone through like the baby steps of fertility treatment. But most of the people I knew had a female factor diagnosis. So they were starting with like Clomid and maybe an IUI to start if it was unexplained infertility. But going straight to IVF, I had not heard before. Um, and our doctor made it seem like that was a good thing, like we didn't have to waste time. And maybe that's true, but it was still like, kind of being hit over the head. Like, wow,
Definitely. Yeah. Yeah.
okay.
It doesn't seem, when you're given that news, it doesn't seem like, oh, this is a good thing, right? You didn't have to go through all this, but it's just
Right.
this big, big news that you weren't expecting. So it doesn't seem like
Yeah, it
like
was like,
you're
oh wow.
saving time or anything like that. Yeah.
Right.
So how did you guys feel when you heard that? Like, what were the conversations the two of you were having?
Yeah, I mean, I think overwhelmed was the first thing that we felt. We didn't,
Hmm.
and that's sort of where my kind of knowledge and experience, like my background in healthcare and my, experience teaching reproductive education, it was I like kind of maxed out, right? Like at this point, like I didn't know what I didn't know, and that was a lot. So I think we were overwhelmed because we weren't experts in, you know assisted reproduction, and we didn't know what we were going to be in for, because nobody is, and treatments aren't a guarantee. But I think, yeah, we were overwhelmed, and we weren't it took a while to get hopeful, I think, and we wanted to rebound and kind of be excited about the possibility of this working for us, but it just felt kind of dark at first. um
Definitely. Yeah. Did
yeah.
you, when you found out about the low sperm count and the male factor,
Yeah.
did you then, were you able to find out why that happened or why that was the case?
Oh yes, that's an important question. Thank you. So yeah.
Yeah, of course.
Yeah, that was kind of the first thing the fertility doctor said was, okay, he had all these pretty invasive questions for my husband about, like his sexual
Mhm.
history, or and his childhood, any like traumatic injuries, things that, he was like, what? No. There was just no indication from him why this was going on. And so he was immediately referred to a urologist specializing in fertility, and we're, lucky to live in the Boston area where we have access to specialists like this. And so the urologist, through ultrasound, was, they kind of initially are looking everywhere in the male reproductive system for what they can find, and they did end up finding a cyst, but unfortunately not a testicular cyst, because that would have been easy to remove. And where the cyst actually is like in the internal parts of the male reproductive system. It's like near the vas deferens, so it's blocking the sperm from entering the ejaculate, basically. Like there's just not enough sperm getting out and joining that fluid, so it's not. And if there's any that do, it's such a small number, and they're damaged.
Mm.
They're not good quality, so they're not able to do their job and swim and fertilize an egg. So it was like, oh
Hmm.
wow, no wonder this didn't work for a year. Basically, it was like we were using protection. Um,
Hmm.
and
Yeah.
so, that was like another initially exciting thing. Like, oh, we found the culprit. This is going to be an easy fix. And unfortunately, the location of the cyst, the urologist explained, like it would do more harm than good to remove it. And so it wasn't a surgical option, because it could do damage to urinary and sexual function. And so he didn't recommend risking that. But
Hmm.
did say, if we can, use IVF, and ICSI, if you're familiar with that term, is that like, where they put the sperm, like penetrate the egg manually in the lab, and that's a recommended treatment for male factor often. So we didn't think he was going to need surgery initially, and like kind of the first cycle we did, they were able to get enough sperm to do IVF with, and so we were excited about that. and and yeah, I can kind of go into that cycle.
Yeah, yeah, go ahead and share what that cycle looked like, and what both you and your husband had to go through to get the fertilized eggs, because it sounds like initially you thought you would be able to have enough sperm without surgery to do IVF, but then it sounds like it turned out that wasn't the case.
Right, and we didn't end up learning that for another like 6 to 8 months. So we did have a successful IVF cycle with a fresh sperm sample with our first clinic. And so that, I think now, unfortunately, if that hadn't worked initially, we could have saved a lot of time. Just like, I
Right.
go back to, if my husband had a semen analysis when we first started trying, that would have saved us a year of heartache. Um, so that was just something I wanted to highlight is, not everybody gets these answers in a slam dunk, but I do think it's worth having kind of basic fertility testing for both partners when you want to start trying, because if you can save yourself time and heartache, I think it's worth it. And
Hmm.
most,
Yeah,
yeah, go
I
ahead.
agree with that. I think that's something that you and I had talked about when we first
Yeah.
chatted, was getting that fertility testing done. If you want to have a family, even if you don't believe there's anything wrong, I mean, your story is very telling of that. Like, it doesn't sound like your husband had any symptoms. He
No.
had no idea. It was shocking to you guys to learn that information. And it's easy to go and get that testing done. It's just something that we don't really think about. Like,
Right.
that's what I like to really promote, is to
Hmm.
get fertility testing done if you want to have kids, because you never know what could come up. And why not just have a basic
Right.
understanding of what's going on with both partners, and you can
Yeah.
maybe save yourself a little bit of time, even if you do have to go through IVF. You can kind of
Right.
save yourself that first year maybe of trying before you can move on to fertility treatments. And so it's something that we don't really like
Right.
plan for.
Right.
And I always kind of talk about it as like, when you're getting married, you do all this planning for like your wedding, right? And when you want to have kids, I think it should be the same, where you look into things and you do some planning and look into your diet and your supplements and all of that. So that's
Right.
a really great message to
Yeah.
share with people. If you want to have kids, just do some testing and see what's going on.
Right. We ended up starting IVF from a place of grief. We had already been kind of grieving because we weren't succeeding for so many
Mhm.
months. Whereas, if he had had that appointment before we started trying and we learned that, it would have still been difficult and devastating news to hear, but I think we would have felt proactive and like, okay, this is our reality, let's tackle it, instead of we already feel beaten down and now we need to
Absolutely.
climb these hurdles, with an injury. Um,
Hmm. Yeah.
but yeah, so we were able to make two embryos, two like mature embryos that can be transferred. Those are the blastocyst level. So we had two make it to that stage in our first IVF cycle. Um, and we also did genetic testing on our embryos, the PGT testing. Um, Even though, at that point I was 33. Um, so it's kind of like, it's more recommended, I think, after the age of 35. But the way that our first doctor kind of sold it to us was like, why wouldn't you do this? And there's a lot, we didn't go into that whole conversation today, or testing versus not. There's lots of different opinions on that, but we ended up always doing genetic testing for our embryos, just hoping for some insurance there, and not wanting to go through more heartache if we transferred an embryo that was abnormal and had to go through a loss. because as we ended up learning, even genetically tested embryos that test normal aren't a guarantee of a pregnancy or a child, and
Hmm.
transfers do
That's
fail.
really important to know. Yeah.
And miscarriages do happen, and I've had both of those experiences with genetically tested embryos. So that those two embryos that we made the first cycle failed outright. There was no pregnancy, and that was shocking because again, I was naive and just thought it was going to be a slam dunk. And it
Right.
wasn't.
Like, oh, we found the issue. We're gonna do IVF, and it didn't
Right. It'll be
didn't
that
work that way.
easy. And I don't want to give grief to like reproductive endocrinologists either, but I think they walk a tough line with their patients of being realistic with them and also trying to, foster hope. It's hard, but our first doctor was very much like, okay, this is a slam dunk case. We're going to sell for male factor, and these two embryos are going to be your two children. I mean, he said that to us. It's
Mm.
like, this is enough for
Oh,
the family
wow.
to build. And so I believed that. And so then it became, okay, this pregnancy didn't happen. It is my fault. And I think I would have felt that way no matter what. But he was like, oh, we need to put you through even more invasive testing because there must be something wrong with you that we missed. So
Mm.
now
Yeah,
I'm,
and when you're told that by your doctor, you just believe them.
of course. And of course, like the next, several rounds of, I did like a 3D ultrasound and a hysteroscopy, all these kind of like uterine cavity evaluations. Nothing was found, so we went ahead with the second transfer a couple months later, and I did achieve a pregnancy to start. And so much so that my first beta, like my HCG levels were so high that he, joked with me over email that I didn't even need a repeat beta. That this
Mm.
was, oh my gosh, congratulations, your numbers are so great. You don't even need another beta, but come in anyway. And wouldn't you
Mm-hmm.
know it, my numbers were lower the second time, which is
Mm.
indicative of a non-viable pregnancy. It just
Right.
doesn't, like, you want to see your numbers doubling at least, and they weren't even increased.
Mm.
So we knew I was going to have a miscarriage. We knew this wasn't a viable pregnancy. And of course it was so early that it was just like wait and see, wait and see, you know, wait for your period, wait for this to pass.
Mm-hmm.
And that was, of course, one of the hardest things I've ever been through. Pregnancy loss, no matter when it happens or how it happens, is incredibly difficult.
Mm-hmm.
I should say October is, Pregnancy and Infant Loss Awareness Month. So another poignant thing to highlight here. Um, yeah,
Yeah, and it is October at the time of this recording, so
yeah, yeah.
yeah, and I'm so sorry for your loss. That is hard,
Huge.
especially when it sounds like you were given a lot of that hope by your doctor, like, oh, your numbers look so great. We maybe don't even need to do more testing.
Right. And you think, miscarriages are most likely to happen in the first trimester if there's a genetic abnormality. Like these are things I knew again from my education and background, and just felt confident with IVF that I wasn't going to have a miscarriage because we were going to solve for all these issues. And,
Right.
of course, people will tell you, oh, you're lucky it happened so early. And of course, like, it only gets more and more devastating as pregnancies continue and you get more connected and you have more symptoms. But even an embryo loss is a significant loss to many people, and just a failed transfer is a major loss. And so
Ab-
here I was, a failed transfer and then an early miscarriage with no embryos left, and wondering what now. and and
Right.
our doctor didn't want to change the course. He just wanted me to do another egg retrieval cycle, another stim cycle, and didn't want to change the protocol or my treatment plans. And I was feeling really dismissed, and like he wasn't listening or providing anything to kind of hold on to hope with, that we were going to adjust something and have a better outcome. And I hadn't been. feeling good about how he was making me feel. So,
Yeah, and I think that is like a natural feeling when if you've gone through that experience and it didn't work out, you want to
right.
do something different, right? And they're
Yeah.
not having that advice or reassurance that something we're going to do something different this time can
Right.
totally be difficult.
Yeah, even if that's just, more of a placebo effect, like it's, you know, you
Right.
need to kind of meet the patient, the patient where they're at, excuse me. And so at that point, I was, really leaning on my community of support. And I had talked to some friends who'd been through IVF. And I remember having a phone call with one of them, and she said, Lauren, it's not worth it to be loyal to a doctor that doesn't make you feel good. And
Hmm.
this is your future. This is the family that you want to build. This is your health. This is everything. You know, you live in Boston, find someone else. You can get a second opinion. It's okay. And of course, we were at such a prestigious clinic that it was like, oh, I hadn't even considered my agency, and I was like with one of the founding doctors, and he's supposed to be the best. And I just felt so indebted to him for some reason. Like I had failed him by not achieving a pregnancy that, you know, went to term, and that's just so warped. But I'm
Right.
glad
Yeah.
I
He's
kind of
such a good doctor, and why
right,
didn't it work out? Right. But I think
right.
that's such a great message that if you don't feel like your doctor is the right fit for you, find a new one.
Right. And
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 I
it's
think a lot of people have a hard time with that.
it is. And even for someone like me who is very comfortable advocating for themselves and for others, it just was a different ball game. I just felt so much more vulnerable than I'd ever felt in my life with any other health situation, that it was harder to advocate for myself. And I did feel like I would do anything and I would go anywhere to make this happen. I was so hung up on this doctor in this clinic. And then I think thanks to my therapist and other people in my life were like, it's okay. We can do this. Just, make some appointments and see what happens. You don't have to commit. And so we did have a consultation with the doctor we ended up transferring our care to about a month, not even a month later, maybe a couple of weeks later. We were really lucky to get in to see her, and it was like night and day. And it was like, oh, this is what it's supposed to feel like. This is what it's supposed to feel like to have a doctor be a champion for you. And I think it may or may not have been. You'll never know, like maybe why we succeeded with her, but I do think having a connection with your provider makes such a difference. And we can't quantify that, right? We can't, it's a qualitative measure, but I do think it's the reason that we were successful. We trusted her
Yeah.
in her knowledge and experience, and she's an excellent, excellent doctor. We trusted all of the ways that she was a good doctor, but I also trusted her because she made us feel seen. She was empathetic and sympathetic to our experience. She explained to us in detail, her opinions on why we have been unsuccessful to date. And we believed her when she said, I think there's a very good chance that we can do this together. And that's what
Hmm.
I needed to hear, you know?
Yeah. Yeah. And that is so important. Like you said, you felt connected to her, and like
Yeah,
maybe that's nothing bad to say about that other doctor, but you just didn't maybe connect with them, and maybe
right.
somebody else would have a great experience with that specific person, but
Sure.
everyone's not going to be for everyone, right? We're not going to be friends with everyone. We're not
Yeah,
going to work well with everyone. So it's really
right.
important to find
Yeah.
somebody you personally connect with.
Yes. And thinking more about like this patient advocacy part of this too, we forget in these relationships where there is a power dynamic, especially in a patient provider relationship, that, you have to do what they say and you can't let them down. And that was a big reason why I had a
Hmm.
hard time leaving and switching doctors and clinics, but they do work for you as the patient, and you are, think of it like you are employing them to provide a service for you. So if you're not having a good experience, you know, you don't have to work with them anymore. It sounds really
Right.
harsh to say I fired my doctor or I fired my therapist, but you have to do that sometimes. And that's looking out for
Hmm.
you and the outcomes that you want.
Right. You have to do what's best for you. Yeah.
Yeah.
So it sounds like you then felt very good about this doctor that you found and you're transferring care to this doctor. So tell me about your experience with this next round.
Yeah, so we were so excited. We loved her. We loved the plan. It was a much different protocol. My first doctor was more conservative with me because I didn't have a diagnosis, but this new doctor felt like, no, let's get as many eggs as we can safely, so we don't have to do this more. And by then I
Right.
understood, yeah, like it's hard to make embryos. It's harder than people think. It's harder to get them to the right stage, blastocyst, and have them be genetically normal. So I had a really successful cycle from my point of view. We, retrieved the most eggs I'd ever retrieved, which is only my second cycle, but it was a significant difference, which I was really happy about. But then she said, but, first she delivered the, like, you have, this many eggs, this is fantastic, but we can't do IVF today because your husband's sample doesn't have enough sperm to work with.
Mm.
And we were not expecting that. It was just another blow. And here I am, like in the PACU, still affected by anesthesia. Um,
Mm.
like what do you mean? What do you mean we can't do IVF today? What happens to these eggs?
Mm.
What happens now? And
Yeah.
so they had to freeze my eggs in order to not lose them. And, luckily, embryology and like the technology now, it used to be that if eggs weren't fertilized, if they weren't, at an embryo stage and frozen, they had a hard time surviving thaw as just an egg.
Hmm.
And that's not necessarily the case anymore. So, but she did explain to me, we could lose some. We might not start with as many as you got today with IVF, but we don't want to lose them all. So we're going to have to freeze them until we figure out what's changed with your husband. So he ended up having to go back to the urologist, and nothing really had changed. It just seems like it's random what is going to come out for him. And this, like, it seems like
Mm.
we actually got lucky with our first cycle that sample had enough to work with, whereas
Oh, interesting. Okay.
yeah, because we have tried a fresh sample almost every cycle since, and it hasn't been usable. Um,
Mm. Okay. So yeah, that first round was maybe just really lucky.
Yeah, and of course, unfortunately, that didn't result in success down the road. But so it ended up being a major setback because he then needed a testicular extraction surgery. So they were going to go in and remove as much testicular sperm as they could in order to do IVF with that because we could not, bank anymore on ejaculate sperm.
Hmm.
And even more disappointing was that they couldn't get him in the OR for 2 more months. So this was
Oh my goodness.
September 2019, and then they couldn't do his surgery until November. Um,
Wow.
and when you've been waiting, and like every month is so precious to someone trying to conceive. It's just another blow. It's just another blow. Um,
Right. Yeah.
and so then I had to just sit tight. My eggs are frozen. My job was done. And here we are licking our wounds again from another curveball. Um, and so we only had 2 months, but it was also like a long time. But that was when he decided to try to be optimizing that sperm with it, and we were pretty living pretty healthy lifestyles as it was, but knowing what we had learned about sperm health and how it regenerates about every 90 days, you do kind of have more ability to affect your male fertility if it is more lifestyle related with male factors. So he started going to
Right.
acupuncture as well, not drinking. We're not smokers anyway, but typically it is cigarettes and alcohol and diet that can have a big impact on sperm health. So he like really tightened everything up. It was a way that he felt like he had some control waiting for surgery, whether it was helpful or not. It was something that he wanted to do that I appreciated because I felt like, I've been putting my body through so much. I've been doing all this optimizing as well. Um, and then, yeah, then he had surgery.
Right. Yeah, and you had that 2 month period, so that was almost like a perfect time where you're in this waiting period for the
Right,
surgery and you have that 90-ish days to really optimize sperm
right.
health. And that's great that you guys were able to understand that and do that research and do what you could to optimize in that waiting period.
Yeah. There's always something, and sometimes, I think we can certainly prey on the vulnerable and people that are really trying to conceive and be throwing like supplements at them or making them think that they can be doing anything and everything and it's their fault if they're not. And some of those things may or may not be helpful, but I do think you're looking for control in this experience. And if you can
Right.
find some control by saying, okay, I'm going to do these things that seem reasonable and I can, and are affordable or whatever works for you, then there's nothing wrong with that if you're not, being misled by a practitioner or provider. But that's another way that where
Definitely.
advocacy is important, that we need to be kind of fact checking people, right? That are catering to this community because there's not much that people won't do.
Because you see a lot of information and advertisements and all of that on like Instagram and just on the internet in general that you
Mhm.
really need to be careful what type of information you believe. I feel like I've seen a lot of advertisements and things like that targeting people who are trying to conceive that don't
Sure.
have the best information, and that can be a little scary. Tell me what happened with the surgery and what was the outcome of that?
Yeah, so the surgery was successful. They were able to extract, you know, like a dozen vials of sperm or something like that. So there was,
Amazing.
more than enough to work with. But that and then they were able at the clinic, but of course it took them several weeks because it wasn't part of their normal schedule where they're doing an egg retrieval. They had to, fit us into their normal treatment schedule to actually fertilize my eggs. So I remember that being very frustrating. Again, having to wait another cycle, basically. And here
Mhm.
we are just squeezing it in before the end of the year when most clinics and labs are shutting down end of year. Like that's another FYI for people is, at the middle to end of December, they're shutting down. They're cleaning, they're people are taking vacation, they're doing everything they can to get ready for the new year. And that's their time to close. So if you don't get your cycles in before the middle of December, you're gonna have to wait again until January. So they were able to do IVF in early December, and that's when I first really learned the harsh realities of the IVF funnel. And if you're not familiar with that term, that is like from the number of eggs retrieved to the number of correct or genetically normal blastocysts at the end. Because I had not very many eggs retrieved my first cycle and still got two embryos. And this cycle where I had like 2 to 3 times more eggs retrieved, we still only got two embryos at the end.
Mhm.
And
Yeah, I
that,
think that's important for people to understand, like, before you go into it, just because you get a number of eggs from your retrieval doesn't mean they're all going to turn into usable embryos.
exactly. Right. And you think, oh my gosh, of course. And even your fertilization rate is going to be, typically around 80%. My fertilization rates were often much higher. Like all the eggs were fertilizing, or most of them were. And then, how many are going to make it, or how many are going to be mature? I'm sorry. It's like retrieved, how many of those are mature? Like pretty much we're all mature. Then how many fertilize is usually about 50%. Um, and I was much higher than that. So I was thinking like,
Mhm.
okay, we have so many embryos to start with. They're all going to make it to day 5. And again, it was 2. And so that was just again devastating. but the two that we made there, we moved ahead with as soon as possible for transfer, and this is one at a time. And I was so excited because it was a different protocol for the transfer cycle with our new doctor, and I felt like this is going to work this time. And again, the transfer failed outright the first time. No pregnancy, despite everything being different and trying to optimize my body to, accept this embryo. Tested, normal, no pregnancy. And so that, I think, I just couldn't understand it. It didn't make sense to me. Everything was different. I felt so good about everything. And again, having to educate myself and be educated from my doctor and saying, like, sometimes it is just bad luck. Sometimes you just are on the wrong side of statistics. And yes, this should have worked. We know that tested embryos have about a 60% chance of resulting in a live birth, which is like not that great. I mean,
Mm-hmm.
you
It's
know,
not. And did you know that going into, was that something that your doctor told you, or is that something that you researched on your own and you understood based on your research?
she told us that. I don't
Okay.
remember like our first doctor telling us these numbers. He very well could
Mm-hmm.
have, or it could have been in like, materials we were given. But yeah, it was like, you know, these are the odds. But I more remember the conversations after the failure. It was like, okay, it typically takes two or three transfers of a normal embryo. I think by I think by transfer three, like 90% of people will have a baby after three transfer cycles of a normal embryo. But it took me four. So at that point, I'd had, the two that didn't work out with our first doctor. This was the third transfer that didn't result in a viable pregnancy. So it should have happened, but I ended up being on the crappy side of statistics again, which happens to so many of us. And then COVID, this was February 2020 that transfer failed. We had no idea what was coming. So another blow, of course, was this pandemic and everything shutting down. We would have done a transfer cycle in April, and they were closed. But we were lucky in that we had a frozen embryo to use, whereas that's what opened up first for these clinics. They weren't doing surgeries, they weren't doing egg retrievals and those stem cycles. But if you had an embryo, they were doing transfer cycles, you know, in their clinic. So that's what we did. It was June 1st, 2020. Nobody knew, which may or may not have been a good thing. I think because it was private, because of the privacy the pandemic ended up giving us, and like we were home, we were kind of nesting more, and we didn't have the pressure of family and friends knowing we were doing this. I often think maybe that was another key piece that helped our chances. Who knows, right? But it did end up being our first child, our first son.
Oh.
So
That's
yeah,
amazing. And it's so interesting to hear because I think everyone has their own feelings about like what worked for you and like what was it
right.
about that cycle? Like it sounded like just being at home and being more like free of responsibilities and relaxed and not having anywhere to go was
Yeah,
it
yeah,
took a lot of stress off of you, it sounded like, and then you were
I
able to
think so.
conceive your first son.
Yeah. Right. I know there's so many factors, there's so many variables. Like no one could ever tell you why a pregnancy works and doesn't really. As much as we know, we know nothing, right? So,
Right,
um,
exactly, exactly. Like you mentioned, even with like those genetically tested embryos, and you were
yeah.
told everything was gonna be fine, and it just didn't work out. And sometimes there's nothing that
Right.
you did, which is so hard to wrap your mind around because we tend to want to like blame on like XYZ. This is why it didn't work, but we'll just never know sometimes.
Right. You want to problem solve. It's human nature to say, okay, let's go back and see what happened. Let's do, a postmortem on this failure, if you will, and see what we can change. And sometimes it is nothing, but I think it takes a special doctor to say, even if we change nothing, this is why it might work this time. And that's what I wasn't getting
Right.
from our first doctor, but we did end up, tweaking things slightly in this next transfer cycle. And really, she called it like throwing everything in the kitchen sink at me just because it didn't hurt and it might help. And I was on board for that. And not everybody might be, but I was willing to do anything she suggested, and everything she suggested made sense to me. It wasn't
Mhm.
outlandish, I didn't think. but
Right.
yeah, so then I,
Yeah.
was pregnant in the first year of COVID, which was another, you know, wild thing to go through after finally kind of getting through IVF the first time, and now I'm at home and I'm terrified of getting COVID, and this, pregnancy is so precious to me, and all of that was very intense. Um,
Yeah, that's very scary, I bet, to be in your first pregnancy or like further along in your pregnancy and
right,
have COVID going on and being worried about catching COVID and
right.
keeping the baby safe and all that.
Yeah, we were very, very cautious, and part of that was my public health background too. I knew this was going to be bad from the beginning. I didn't know it was going to be as bad as it ended up being, of course, but I was like, oh, we need to take this seriously. But because of our fertility experience, we were a lot more cautious than most. When a lot of people kind of became disillusioned with precautions by like the second half of 2020 and we're not really caring as much or being as careful, people in our lives started having weddings again that fall. It was just things that like we couldn't fathom doing, or putting ourselves and our baby at risk. So that was
Mhm.
another kind of hard thing. And there weren't vaccines for us until after he was born. It wasn't until the spring of
Mhm.
2021 that they were readily available. So, yeah, thrilled that he arrived in February of 2021, but then it was
Right.
just the three of us. We didn't allow anyone into our home to help because of COVID. So,
Right. Yeah, that's hard.
yeah,
Definitely.
but
Um,
yeah.
so then you had your first son, and how long in between the birth of your first son did you decide to do it again, do it all over again, and try for a second baby?
Yeah, it's so interesting because I remember thinking and saying with my husband before we had him and we were on this journey, you know, we just want to have a baby. Like happy with one. We don't need to have a bunch of kids. Like we don't need to have the two we thought we would have. And then being that was our last embryo, that he was our kind of last chance of that cycle, and to have it work out, we were like maybe we're done here. But as soon as he was born, I knew I wasn't done. Which
Oh,
surprised me.
yeah,
I was just like, oh yeah, I can do this again. I can do this again.
yeah.
Um, but I think I would say that like that first year of his life was the most, I think, peaceful for us because we weren't trying to conceive for the first time in so long. Um,
Mm.
we were
Because it was
just,
about 3 years, right, between when you
yeah,
started and. Okay.
exactly. Like just over 3 years that he arrived. Um, So we were just so content and so, obviously in love with him, and we're so just happy to be a family. The three of us finally, that it was nice to not worry about it. But as soon as his first birthday happened, I was like, okay, it started churning again in my brain about planning ahead and when are we going to do this. And I was breastfeeding, and I didn't want to stop that early in order to do IVF again, which is something not a lot of people know about either. Is in order to do a stim cycle, most likely you're going to have to wean because
Mm,
your breastfeeding hormones can interfere with the process, and or the meds could be dangerous to your baby. There's a lot we don't know, but it's not
definitely.
recommended. So I didn't want IVF to take my kind of breastfeeding relationship away or cut it short. But we did have a consultation with our doctor when he was like 15 months old, almost a year and a half. And that's when, she was like, you don't need to rush. We've got a good protocol. We have a plan. You're only 35 at that point. So she was like, we've got plenty of sperm frozen. We just, take your time with nursing me when you want to and let me know when you're ready. And so I had decided to wait until my son was 2 before doing IVF again. So that's what we did. We started over.
Mhm.
I did an IVF cycle in March of 2023. Um,
Okay. And tell
Fresh.
me the story about what was different with your, after you started IVF again to try for your second, with
Mm.
like the medications and your experience with that, because I think this is a really interesting story for people to hear.
Yeah. So in terms of like the protocol was um, the same, but what we had learned in between my son and trying IVF again was that I had new food allergies. And so for this, that didn't matter for the stim cycles because there are not like food ingredients in those stimulating medications. But by the time we finally got to a transfer, it lasts a year, almost a year ago exactly. It took, unfortunately, 3 stim cycles to get to a transfer this time around, which was another shock because, you know, we had successfully created embryos before that had tested genetically normal, but this time around we had a failed cycle outright where no embryos made it to blast, and we also had a cycle where both of them tested abnormal. So we were like 0 for 4 with the first 2 cycles last year. And then finally, the third cycle we did got 2 embryos again. And so we're preparing for a transfer cycle finally and learning that the progesterone medications I would be taking are in peanut oil and sesame oil. And I'm like, oh, well, I have borderline allergies for both peanut and sesame. What does this mean? Can I can I even take these medications? And so consulting with my allergist and my fertility doctor, they were both resoundingly like, no, absolutely not. This is a risk you should not take,
Oh,
especially where you're
definitely.
injecting um, this into your body. I mean, it can be a lot riskier than you know putting in your mouth potentially, or
Hmm.
just as risky. So I ended up having
And the
to.
first, sorry to interrupt you, the first time you did those injections, did you not have that allergy at that time, or what was the difference there?
Yeah, I didn't. Those allergies
Okay.
weren't known when I was doing IVF with my first son, when I did those medications for
Okay.
those transfer cycles. I do, of course, I do wonder, is that why that first transfer failed? I don't know.
Interesting. Yeah.
Um,
Right.
why did it take me 4 transfers to have a successful outcome? Was it because I actually did have these allergies sort of under the surface we didn't know about? Maybe, maybe not. Maybe they did kind of appear postpartum, which is also common. It could be.
Yeah.
It's just so frustrating how you just can't get these answers, but we knew at that point, and it was actually a friend of mine that flagged it up to me. She was like, the progesterone in oil is in sesame oil, and I was like, what? Oh my god, Um,
Yeah.
so
Interesting.
and I hadn't shared those allergies with my fertility clinic, which I should have, because I didn't realize that those, food oils were in medications. And they should ask you, but it was something that we missed. And so then we were scrambling to get the compound pharmacy to make me specialty progesterone injections and also suppositories because I was prescribed
Hmm.
2 different forms of progesterone after embryo transfer, and one was peanut and one was sesame. And so now I'm paying out of
Hmm.
pocket for compound medications, and it ended
Yeah,
up,
that is so interesting because
yeah,
those are such common allergies. It's
exactly.
interesting why they would put those oils in those medications. But
Yeah, it's
so
mind
it
blowing.
sounds like that was something that you guys that added an extra cost for you because you had to
Yes.
have those like compounded or personalized injections made.
Yes, and every insurance plan is different, of course, and they have kind of like their own section on compound medications and what they will cover. And I, had to get a letter from my allergist, a letter from the fertility doctor, and all of this stuff, and all the receipts from the pharmacy. And I still haven't been reimbursed. This is almost a year later. And I had to take these medications, some of them for the whole first trimester.
Mm.
You end up taking the progesterone for 10 weeks. And so I had to get it refilled several times. And because it was a compound, like they're only fresh for so long. It's less of a shelf life than the traditional like sesame and oil or the suppositories. So it just added
Mhm.
a lot more stress to that transfer cycle. And of course, this was the only viable embryo we made. Of the two that we got, one of them didn't survive thaw. So we ended up with actually just the one at the end of the day. And so grateful that that resulted in our second son, who was just born in July. But that transfer cycle was really stressful to get the right medications, and knowing this
I
is
can
our
imagine.
only hope this year, not wanting to ever do IVF again. So yeah, it took in total five IVF cycles, five egg retrievals, and then five transfer cycles to get our two children.
Yeah.
And
And now
so
you have another baby boy.
another boy, yes, yes.
Oh, and that was just born in July. Congratulations.
Thank you.
So newborn, real you have a newborn, really?
He's
That
12
is
weeks today.
amazing.
12 weeks today.
Wow,
Yes,
wow.
I guess.
Congratulations. That is amazing. You went through so much to have your two sons, and I think your story is really unique, and I think it will help a lot of people to hear that, to hear your male factor fertility story that I feel
Yeah,
like isn't talked about enough. So
right.
thank you for sharing that. I
Thank
would
you.
love for you to talk a little bit about your experience, how your experience with IVF
Mm.
led to you wanting to get more involved with the community and advocacy and all that.
Oh, for sure. I mean, I think there's just such a deep desire in my heart to give back. And, I've always just kind of had the personal motto of be who you needed. um, and that is just so
Mm.
important to me. Like I said, you don't know what you don't know in this process until you go through it sometimes. And it can be very lonely and isolating and difficult. And I just, it's so important to me to support others on their journey if they're, open to it. And I think most people are and just don't know where to look. And so, getting involved with All Paths Family Building is an incredible nonprofit that does, support along with resources, education, and advocacy work for the fertility and family building space. But they have almost 20 unique support groups for people in this community, all different topics. So when my son was about a year old, I started leading the Expecting After Infertility and or Loss group. So I've been doing that for over 2 years now, and it's just been a really amazing way to connect with others in the community and try to lift them up and hold their hand, figuratively, while they're going through a really stressful time and need support.
Hmm. That's wonderful. How can people, like, if somebody needs that support, how do they get involved with that, or how do they seek that support?
Yeah, so definitely check out the All Paths website. I can give you the link there. They also have amazing social pages, and you can sign up on their website for the support groups. They're free, they're virtual, they're all over Zoom, so you don't have to be in the Boston area where they're headquartered to attend. So anyone can can attend.
Okay, yeah, I'll put that link in the show notes. If you want to send that to me, I'll make sure I link that in the show notes for everybody. And then what else are you doing to help advocate for the fertility community and
Yeah.
just maternal and child health in general?
Yeah, so my kind of career pivot, I think, is typical of a lot of women when they become mothers. We just realize, okay, my life has completely changed for the better and your values become crystal clear when you become a parent. Not that people aren't value driven if they're not parents, but it's such a seismic shift. And going through infertility, having that overlap with the pandemic and then becoming a parent, like those things all kind of swirling together. I kind of call it my personal reckoning because it was, and it's kind of shifted how I think about my career and how I want to spend my time. And so I ended up kind of pivoting from the corporate world, and deciding, I really wanted to get back to like the roots of my passions in public health. And that, was maternal and child health. And of course, part of maternal health and supporting those in the perinatal period, whether it's, preconception, pregnancy, or postpartum, fertility and family building is such a big piece of that maybe isn't given as much attention when people are focused on, just pregnancy or postpartum. And so my own experience with infertility kind of led me to the obvious, junction of these two worlds, whereas fertility and family building are part of maternal and child health. And my kind of professional experience before that, working in child psychiatry, before a healthcare startup, mental health is something that I really want to champion as well, and have always meant a lot to me. And it all overlaps. It's all connected for me. So what I want to do, what I'm doing with the Village Advocate is just trying to provide the public health lens, of, education and advocacy are like what I'm most fired up about doing and providing, to these communities that are very connected. And so, how do we support people that are in the trenches in these areas?
Absolutely. I think that's so important. And I think it's wonderful that you took this really hard experience that you had and turned it into how can I help others going
Right.
through this experience and how can I advocate for them and be like you said, be that person that you needed. I think
Right.
that's really important.
Yeah, I think, I've met so many incredible people in my life, and especially since doing more of this focus work, is that, so many of these people have turned their pain into purpose. And that's exactly what I'm trying to do as well. And that, helping other people, go through something difficult can be the best way to heal yourself. Um, and that giving back is
Yeah.
so important.
Well, wonderful, Lauren. Where can everyone connect with you, follow you on social media,
Yes.
um, get get involved? Like I said, I'll put
Yeah.
this link, all those links in the show notes. But where can everyone find you?
Yeah, you can find me on Instagram, and I can send you all of, on LinkedIn or my website, so I can send you all that information. Yeah.
Yeah, and I'll link all of that in the show notes if you
Yeah.
all want to connect with Lauren. All
Thank
right, thank you so much for your time today. That was
you.
such a great story. Thank you for sharing all of that. I know it can be really difficult to talk about those hard times, but we appreciate you sharing with us. Thank you
Yes,
so much.
thank you for listening. Thank you so much for using your platform to help others.
Wait, don't go yet. If you're experiencing fertility struggles and want to chat about how I can help you as a fertility nutritionist and fertility coach, just click the link in the show notes and schedule a free 30-minute consultation with me where we can chat about your needs and how I can help you get pregnant. Don't forget to follow me on Instagram at sprout.fertility and TikTok at sproutfertility. I can't wait to hear from you.